So not being a great artist, and you know, I've got to just tell you right off the bat, I'm going to do the best I can just to make some generalized points on this particular subject, which is really pretty common. And what I'm going to do is try to draw out this situation right here, where I've got a bone above and bone below, and a part of the bone that goes out, leaving a hole right here for the nerve. And then if you look at the disc itself, it's white on either end. The white actually goes all the way around the disc, and the softer part is in the middle. So let me draw that in. Right here. Now in this, what I'm going to call fairly normal situation, there's a little bit of a curve. I certainly didn't draw that perfectly. I drew it more as the disc is bigger in the front than the back, but you're really just to make the point, there's a normal curve in your back. The hole where the nerve goes through, the foramen, is big enough for the nerve, and generally speaking, a little bit of extra playroom in there. There's a little safety valve almost that we're bored with. In this situation where the disc helps a cushion or spring combined with the normal curve in your back is something that most of us essentially go through life not even thinking we have a back until things go bad. So here I'm going to draw next to this as best I can situation where things have worn out. And this is more of an end stage issue now. Here, is the nerve again. Not only is the hole less, but now that annulus protrudes or sticks out, and there's less of that soft material in between. Most of this is really hardened up at this point. So by making the hole smaller and the covering around that disc, the annulus, protruding, prolapsing, bulging out, also irritating the nerve, becomes problematic. And these are patients that I would see in my office pretty frequently. And I tend to see patients that have already been through already conservative care, even years of conservative treatment. And there's one other thing too, if you notice, they've lost their normal curve here. If you drew in the next disc, it potentially would be even more lordotic, more curved to it to make up for this. And over time, this has a chance of wearing out very fast, also sort of more advanced than it would to make up the slack. These sort of situations where patients wear out their disc or they're injured is something that's gone on for probably as long as we've been upright and walking. It's a very common problem, and occasionally it's so severe that surgery becomes an option. In years past, fixing this sort of thing surgeons weren't paying as much attention to trying to go back to the normal because we didn't think you could do it. And the results years ago, I don't think were nearly as good as they can be today. And the real key difference, and it's something that I had helped work on also, was how do you go from here back to here, at least as much as we possibly can. And here's what we did, and here's what I do. We try to go back to a situation where there's space between the bones and you have a normal curve. We put the curve back in. We do that, we try to do that every time that it's appropriate. And in the low back, that's pretty often. But when you do that, and that disc is now removed as completely as we can, those bones will fall right back together unless we prop them up. And so the device that we use to prop them up are called cages. And in this situation, I've drawn it as bigger in the front than the back. That's because in this situation, I'm trying to put the normal curve back, the lordosis. And it will prop the bones open. Mixed with bone, which is the fusion part of this, it will essentially hold this situation. This hole, hopefully, won't be able to ever close back down, at least not to this degree. We can maintain the proper alignment of the back. And that means that people can be really quite active once this heals up and we secure this situation. And that would be, doing things such as just making your meals, getting up and getting going in the morning, things that almost seem mundane, but trust me, if you've got a back problem, they're really chores. To holding your job, to twisting, to bending, lifting. And we think this gives a long-term result. I've been at this now for over 20 years using these sort of devices, so I've got a pretty good clue as to what my results are.